At Fortis Healthcare, Swagatam. Good evening, everyone. And today we are
Good evening.
starting a mega live session, and the theme is Aarogya Bharatam, Samriddhi Bharatam. So, basic thing is that we'll be completing about 80 years since independence next year, and before independence, if you look at it, disease burden was communicable diseases. Now it is becoming non-communicable diseases. That's the major burden that we are facing. The other part is like the government is now and India is looking forward for.
What time do we start?
Yes. So India is looking forward for 2047 Bishnu Bharat, and for that we need to have a healthy India. And I think so. Fortis being one of the major corporate healthcare players, so we are now putting a lot of focus on how do we keep people healthy. If you look at the latest logo, it has this. So how do we keep people healthy? So the curative aspect is there, which will happen. But I think so the preventive aspect is something that we have to work on. If you have to keep talking about the demographic dividend, how do we keep them healthy? And there's another segment, the aging segment also, which still are productive. Those who are also aged and retired, how do we keep them healthy and take care of them? So keeping all that in mind, today we have a very nice panel of doctors from different specialties. We have Dr. Pankaj Puri from gastroenterology and hepatology, Dr. Tullimai from cardiology, Dr. Sohail Qureshi, he's an oncologist. We have Saurav Bansal, he's a neurologist. Dr. Preeti Salan is a physician, internal medicine consultant, and Dr. Kedar, who's from the mental health segment. Mental health is a major issue in the globe now. Even the WHO has also highlighted that. So keeping that in mind, we are starting this session, and the basic premise is, as I said, it is we are not pitching for anything else other than preventive aspects. So how do we keep people healthy? And I think so. There's no better forum than hearing the subject matter experts give their opinion, give their points. And I think so. I'll urge the people who are listening to this to please take this as some of the take-home points to forward. So I'll start with Dr. Pankaj Puri. So, how modern lifestyle and stress are quietly harming gut and liver health in Indians, and how should we manage it? So, Pankaj, could you hear me? Pankaj, could you...
The sound is not clear. Can everybody hear?
Sir, I think someone's mic is on. It would help if only the speaker's mic is on and the others, all of us, mute our mic. Otherwise, the voice will echo.
True. There's an echo which is very unclear.
Am I audible? Am I audible? So again, I'll just take it, refresh everyone is because there was some technical glitch. Is that it's the Fortis Healthcare is now looking at how do we sort
Dr.
of...
Vishnu said something which I can't. I don't know. Can you everybody hear Dr. Vishnu when he says something? Yeah, I can't hear.
Just give it 2 minutes, just 1 second, sorry.
Yeah, we can hear, sir. We can hear.
You can hear me now?
I can hear everybody except Dr. Vishnu. I'm sorry.
Yes, Sohail, can you hear me?
I can hear you, sir, loud and clear. I can hear you. I can even hear Dr. Pankaj Puri, sir.
So I can hear everybody except Dr. Vishnu. I don't know. Maybe I'll log out and log in again.
You log out and...
I'm just logging out to log in again. Good evening, Dr. Vishnu.
Yeah,
I can hear you now. I don't know, must have been something wrong with the link.
okay. Namaskar, Swagatam from Fortis Healthcare. I'm Dr. Bishnu Panigrahi speaking. And as I say that Aarogya Bharatam, Samriddhi Bharatam, a healthy India is a prosperous India. So one of the focus areas of Fortis Healthcare in the recent past is that while we take care of the curative aspect of it, how do we keep people healthy? So I think so we should live up to our trademark, our sort of logo that is there. This. So we have to take care of people and keep them healthy. So the demographic dividend that India keeps talking about for us to reach to the Viksit Bharat in 2047, I think so. This is a very important segment of people that needs to be kept healthy to go towards a prosperous India. We also have another segment who are aging. How do we take care of them? Keeping that in mind, today we have a esteemed panelist of doctors from across the Fortis network. So I'll start off with Dr. Pankaj Puri, is a senior gastroenterologist, hepatologist. Dr. Atul Lima is a senior cardiologist. Dr. Sohail Qureshi is a renowned medical oncologist. Dr. Saurabh Bansal is a neurologist. Dr. Preeti Salan is an internal medicine physician, and Dr. Kedar is from psychiatry, from the mental health program that we run. And Fortis is one of the few organizations globally who has a mental health hospital now dedicated to IP patients. And mental health is a major issue that's coming up across the globe. India is no exception. So keeping that in mind, we also had invited him also, and he's thank you for being on the panel. So with that, I'd like to start off with Dr. Pankaj Puri. So Pankaj, the question that comes to mind is how modern lifestyle and stress are quietly harming gut and liver health in Indians, and how do we manage it?
Sorry, some of the thank you for the question, sir. Our lifespan is increasing. We have many more older people, and we are getting more people. Our lifespan used to be just in the 50s earlier, and now people are living much longer. So we are seeing more and more diseases, and some of the diseases which have become very common is fatty liver. And people who go on to fatty liver, almost 1/3 of our people have fatty liver. And if you look at the middle-aged population, it is very common. It's more common in people who have diabetes. People are no longer doing exercise. They will be sitting on their couches and watching television. And inactivity is one thing which has crept into our lifestyle. And our diet has become more westernized. It has more fat in our diet. So with the net result, there is increasing obesity. We are having a lot of people who come with us with fatty liver, and fatty liver is not innocuous. People say, so what? Everybody has, every second person, third person has fatty liver. But we noted that people who have fatty liver can go on to get progressive liver disease, liver failure, hepatic encephalopathy, and even can go on to need a liver transplantation. So we need to look for it. We need to screen for fatty liver and the need for medication, and need to treat it. We need to focus on lifestyle measures and need for drugs and prevention. So one aspect is liver fat. Second is, with increasing social norms, there is increased alcohol intake. Now this is very dichotomous, and some people, even the younger people, have stopped having alcohol, and there's a huge population where the amount of alcohol is going beyond the limits. And we have a lot of people who come to us with fatty liver disease. Third thing which is happening, which I find our lifestyle is changing, is our diet has changed immensely. With the change in diet, we used to have very little colonic cancer earlier. And now with a change in our diet, we have a lot of westernized diet in our people. And we are getting a lot more colonic cancers, and we need to seriously think about screening for colonic cancer. Not just saying a little bit of blood is because of piles. And even if you don't have symptoms, the time has come where we as a population need to consider screening as we grow older. In the West, everybody undergoes colonoscopy every 5 years, beyond the age of 50 years. And it's time that we go down that path as well. So these are 2-3 things which instantly come into my mind: increasing fatty liver, increasing alcoholic liver disease. And third thing is a lot of focus on need for colonic screening. Of course, as we grow older and the population ages more, we have many more other malignancies also come, and we need to start thinking and screening for those as well. And of course, we have a good oncologist in our panel. He will tell us more.
Pankaj, just quick one on the fatty liver, because there's a lot of talk about fatty liver. So the public at large, what is your take-home message for them? So what are the things that they should do exactly to prevent a fatty liver, or those who have a fatty liver? How do we? What are the things that they need to do to mitigate it from getting enhanced?
So first, number one, 1/3 people have fatty liver. And you should be screened for fatty liver if you have diabetes, if you're obese, if you have other features of metabolic syndrome, you're a hypertensive, and you have hyperlipidemia, then you should be screened for fatty liver. The first thing is screen for it. Second thing is, don't go away thinking that a fatty liver is innocuous. A fatty liver can lead on to progressive liver disease. The next is, if you need medication, it is important that you meet a doctor, but lifestyle measures are the cornerstone of management. You have to go ahead and lose weight, control your diet, do regular exercises. If you're a diabetic, control sugars. Those are all important part. Exercise is very important, and that is, diet and exercise is another important part of management. Diet should be having lower saturated fats. There should be a lesser amount of carbohydrate and calorie intake, and you should increase your fibers and increase your proteins. These will improve satiety and decrease the calorie intake. Your weight loss target should be 2 to 4 kilos a month if you're obese, and your exercise requirement goes on to about 45 minutes of aerobic exercise every day. And if you're doing resistance exercises, that requirement is 1 to 2 hours a week. And there's a lot more amount exercise. Which type of exercise people go on? Should I have, should it be HIIT, or should it be aerobic? Should it be resistance? I think a combination of all these, dominantly aerobic and some component of resistance is good. HIIT, you manage to do the same thing in a smaller period of time, and it's really focuses more on cardiac fitness. But for the general public, a lot of aerobic. Aerobic will be brisk walking, jogging, swimming, cycling. These are all important things. And I think we need to go back to our roots as what our predecessors used to do, and do a lot more exercise, walk more, use the bike less, ask the children to start playing outside instead of sitting and playing video games. I think our lifestyle needs to go back to what it was earlier.
Thank you. Dr. Suhail Qureshi, and coming to you is that how can early screening and preventive practices significantly reduce cancer-related mortality in India? Because as you know that India, the cancer burden is increasing, and we are having nearly about 1.5 million new cases a year, which is huge. So what is it that what are the screenings we should do? And in your opinion, what are the messages that you should give out to people at large?
So thank you very much, sir, and a big hello to all the fellow panelists. Thank you, sir, for taking the opportunity to address these very relevant questions. And Dr. Pankaj sir before me has spoken eloquently about going back to our roots, and I think he's hit the nail on its head. That even for cancer in the 21st century, it is very true if I say that much like blood pressure and diabetes, cancer as well is a lifestyle disorder now. So there was a quiz a few months back in which I was one of the observers, and I was overlooking the students who were participating. So there was a picture which showed a cigarette, a bottle of whiskey, a chair kept on a chair, and this cocaine. And they asked, which is the most dangerous practice? So someone put the answer as cigarette, someone put the answer as alcohol, someone put the answer as drugs. But the answer, correct answer, was the chair. In 21st century, sitting is the new smoking. And as sir very rightly said, that we have to go back to our roots to become more active, to become more indulgent in physical activities, and get out of this Swiggy and Zomato culture where we are mindlessly ordering at 2 o'clock at night from any restaurant of our choice and just taking down calories without even acknowledging how much we are able to consume the calories, because we are just watching a movie or a web series and we're ordering at 2 o'clock at night some pizzas and burgers. That is the peril of the 21st century technology. Me about screening. So in India, 1.5 million cases is one aspect of the disease. The second aspect is that most of these cases, about 75%, three-fourths, are detected in either stage 3 or stage 4. And that makes cure a very difficult or sometimes a highly unlikely scenario. The usual suspects are your tobacco, alcohol, and cigarette smoking, your late marriages, the late age at first childbirth. These are all situations which predispose you to develop breast cancer and ovarian cancer. So the point of the matter is, you asked me about screening. So early detection is the key for curing the cancers and to go do away with the cancers by all means. Because in stage 3 and stage 4, we're only running after the disease. The disease is running ahead of us. So if I talk about screening practices that you asked me, number one, cervical cancer, the most prevalent cancer in India amongst females other than breast cancer. It is now preventable by a very effective vaccine, which should be started between the ages of 9 to 14, and all girls between the age of 9 to 14 should be advised to take 2 doses of this vaccine. And now our finance minister Nirmala Sitharaman had actually included this vaccination as a part of the universal immunization program in the last budget in 2025. So between the age of 9 to 15, cervical cancer vaccination. This can even be taken up to the age of 45 years if someone has missed the bus at that time. Idea is it should be taken before the onset of sexual maturity, but if you have not taken it, then up to the age of 45, it can still be taken. Number 2, breast cancer, another very common cancer in females, very easily preventable by doing screening mammograms after the age of 40. So every woman after the age of 40, once a year, a screening mammogram is recommended. After the age of 35, clinical breast examination by a doctor should also be a part of screening strategies. Colonoscopies, Dr. Puri sir highlighted, after 50 years, it is recommended that every individual, male as well as female, should undergo a screening colonoscopy at least once every 2 years. A pap smear every at the age of 21, and then every 2 years should be undertaken for the prevention of cervical cancer. Then your oral cavity cancers are highly preventable if you go for a regular dental or an oral cavity examination and you do away with practices like gutka and pan masala and the so-called Zuba Kesari lifestyle that is so common amongst our youth today. So these are some of the easily recognizable, easily preventable cancers, which if combined together would include around 60% of the cancers we see in the OPD.
Thank you. Now coming to Dr. Saurabh, our neurologist at Fortis Hospital MRI at Gurgaon. Saurabh, a couple of months back, Dr. Kavashya Prasad, the former HOD of neurology at AIIMS, and we attended a FICCI organized stroke summit, which was organized by FICCI, and the World Stroke Association president had come. And it was music to my ears, news to me, that during the pandemic, more people died of stroke than the pandemic. So in fact, in WHO, the internal discussions was that should we declare stroke as a pandemic? It was just lightly mentioned, and he mentioned that. So what I'm trying to say is that India is no exception. We are getting a rising number of stroke cases across the country, and it varies from age groups. As I was mentioning about the elderly, Dementia is another one that is creeping up. So, how critical is preventing to protect them from these, the stroke and the dementia part? What are, in your opinion, what are the take-home messages they should give to the public who are hearing this, listening this?
First of all, thank you for having me and thank you for asking this question, sir. So, I think rightly said, prevention is extremely critical and is the most important tool. Unfortunately, it's neglected, and most of the times, when the patients first land up in the emergency, that is the time they realize, oh, abhi to blood pressure hai, abhi diabetes hai. So, important is prevention and recognition, because many disorders they do not develop overnight. They are the cumulative effect, or they are silently hidden and they are developing over a period of time. So, because why it matters is because prevention, brain has limited regeneration capacity in comparison to the other body parts like liver, skin, and all that. So, more we are able to prevent, take care of the risk factors, we are able to hold a good cognitive reserve. So what is good for the heart is also good for the brain. So like, having control of blood pressure, diabetes, quitting smoking, alcohol, weight reduction, avoiding sedentary lifestyle. So many of these risk factors, if we see, they are modifiable. So hence, if we take care of this, indirectly we are taking good enough preventive measures to prevent the risk of developing stroke in future, as well as risk of preventing dementia. And as correctly said, sir, stroke, earlier it used to be think we used to think it's a disease of 50s, 60s, but these days I'm sure everyone is seeing and hearing as well, even in 40s, 30s, people are getting strokes, and not a small one, big ones, and sometimes leading to mortality as well. So yes, prevention is the most important and unfortunately a bit neglected tool, which we should focus more strongly on.
The dementia part, what is your take-home message?
So, sir, dementia is most important thing. Why we feel is there are, first of all, there is a myth that all dementias are not treatable. So I think most important thing is one should recognize there are treatable causes of dementia, and there are some of them are degenerative and progressive. So important, we should make sure that we are having a good lifestyle, good diet. We are not B12 deficient, thyroid functions are taken care of. One is having a good quality of sleep, stress factors are being taken care of, sedentary lifestyle, as said, 30-40 minutes of aerobic exercises, loneliness, social isolation. They are indirectly risk factors which have been scientifically shown to have a reduced hippocampal volume, which is the indirect marker of memory in a person. So if we are able to take care of these preventive aspects, so dementia can be prevented or delayed to an extent, and keeping yourself busy in brain exercises, sudokus, and etc. Such things, they can help to a large extent.
Thank you. Now, moving to Dr. Atul Limai, a cardiologist from Mumbai, the financial capital. And what is of concern presently now is that if you look at it, earlier the heart diseases we were thinking that it's only the elderly. But of late, we are seeing a lot of younger age group people getting affected, which is a concern. We talk about the demographic dividend. Now, how do we keep this demographic dividend healthy? So Atul, what is your message, take-home message, that what preventive measures can change this trend? Who has got it has got it, but at least let's put up some things that the public at large should try to adhere to and follow to see that they don't get into that trap.
So I just came from the cath lab, and let me just describe to you the patient who was on the table. He was a 37-year-old gentleman, 37, who 3-4 days ago had some acid peptic reflux type symptoms and some upper back pain, which he decided was not related to his heart because he never had any heart problems before. And this morning, he couldn't get up and he had slurred speech. So he actually came in with neurological symptoms, and it turns out that he had a large MCA territory infarct. And when we did the ECG, his ECG had severe ST elevations across his anterior leads, suggestive of a large anterior wall MI. So to piece it together, what had happened is that 3-4 days back was when he had his massive MI. That MI caused his heart to fail. He had LV dysfunction. that led to a clot in the left ventricle, and that clot from the heart migrated to his brain arteries and caused a stroke. So you can imagine he's intubated, he's in big trouble. So this is the sort of epidemic of coronary artery disease that we are seeing in our country nowadays. Younger and younger people, and you see it in newspapers all the time. People get up, they go to exercise, they're going to the gym, and the next thing you know is they're having a massive heart attack. And many a times there are fatalities from these heart attacks. So I think people are still struggling to precisely explain what is causing this epidemic of heart disease in young individuals in our country. This is very, very different from the Western countries. In the Western countries, heart disease starts at a much, much later age, typically, 45 plus, 50 plus. In our country, all of you must have seen anecdotes of people as young as 25, 28, 32 who are having massive heart attacks and coming to our hospitals. And I think I'm not trying to give you an overarching explanation of what is going on. What I think is part of the explanation, certainly, is what has already been talked about, which is our lifestyles and the sorts of things that we are ingesting, the sedentary lifestyle that we are having, tobacco use, the pan parag and gutka, and the lack of exercise, and the overwhelming stress that people are sort of subjected to in their daily lives. Now, one of the things that I also wanted to talk about, slightly different, is something that I have been paying attention to in the last several years. And this is the impact of social network, your own personal social network on your health. What do I mean by that? What I mean is, if you look at the friends that you have, and this is not by you, I mean whoever is listening to our podcast, if you look at the friends that you have, the social circles that you move in, the kinds of lifestyle that your friend's spouse or sibling has, it turns out that our lifestyles to a large extent are predicated on the social company we keep. And I find that very interesting because if I look at myself and my personal life, Dr. Panigrahi knows I'm an avid runner. And I thought to myself, who are my friends? Who are in my social connection? And it won't surprise you to know that 90% of the people that I hang out with are fellow runners or people who are in some sort of training, strength training, weightlifting, running, swimming, they play some sport. And so I have started to believe that social connections and your social network is very, very important. So I think that if someone is trying to do some lifestyle changes, one of the things that is paramount is look around and see who you're hanging out with. Who are your siblings, who are your spouses, and who are your friends? And make some changes there. Obviously, I'm not suggesting changing your spouses or siblings, but but I think that if we can somehow take some steps to change our social connections, I think it will go a long, long way in trying to foster some healthy lifestyle in ourselves. Healthy eating, healthy exercise, quitting tobacco, quitting smoking, and generally reducing the stress levels in our lives. I think if that sort of rings a bell or appeals to you, I would encourage everybody to take a look at that.
Thank you, Atul. It was a very nice messaging actually for the youth to hear and adhere to. Now come to Dr. Kedar. Dr. Kedar, if you look at it now, even in the last FICCI meeting which we had in October of 2026, right from the health minister to the Niti Aayog members, Dr. Vinod Paul was there. All of them harped on mental health, that the government of India is putting a lot of effort on how do we tackle this, because it is what we see is tip of the iceberg. There's below the water, there's a lot of patients of that building up. And WHO has also highlighted this, flagged this. So India is no exception. So why is mental health prevention essential for a resilient and prosperous India?
Right, so before I say thank you for having me on this panel, I have to thank you wholeheartedly for actually setting up a state of the art facility in mental health, which was absolutely necessary for the entire country. And you have been a flag bearer in that. So thank you for that. Uh, and thank you for having me on this panel today. Why is it important to have a preventive aspect to mental health? Because most mental health disorders will follow the psychosocial model. And before the biological processes become set, there will be psychological stresses or social factors, usually, which will precipitate it, not to mention genetic predisposition. But if you have a coping skill which you can use, if you have a resilience which you can utilize, if you have, like Dr. Limay was just pointing out, to a social network which can help you, give you the hand to guide you to the right place or be there for you in your time of need, then the chances of precipitating a major psychiatric illness reduces drastically. To further add to these points, there have been 3 or 4 changes in the past 5 to 6 years, which have affected how we go about handling our day-to-day life. Extremely impactful changes. First one is the declaration of a loneliness pandemic, which came in 2022, I think, or 2021 or 2022, just following COVID. Like our neurologist was telling us, it is one of the prognostic factors for strokes, not to mention increasing level of anxieties. Then there is the fact that we are actually having to use digital interfaces much more than we accounted for. Now, this has twofold impacts. One is the amount of screen time has increased, so the human connect, which would actually build you a resilience, is gone down. And because of this, the dopamine surges that you are used to and that you're getting are coming more and more from screen times, which are completely preventable, completely manageable if you are able to schedule your times. This is something which is lacking drastically. The third is with the declaration of the information pandemic, we are having a situation where people have opinions on everything, whether they have wanted to have an opinion or no. As a result of the disinformation, a lot of recreational drug use has gone up. And we are seeing the effects and side effects on the lifestyles as well as end results in not only major physical illnesses but psychiatric illnesses also. Combined, this has led to a surge in anxiety and depression, so much so that it has started to affect workforces and started to affect productivity. Uh, to be very clear, in India by itself, only 10 to 15% of the people who actually need access to mental health care will get it, even though we are one of the countries who actually have an extremely robust network, internet services are available, but we still somehow lack in assessing mental health care. So all of this adds up to worsening of your anxiety states, depressive states. There has been clear cut connections established where duration of untreated psychosis actually affects the severity of the illness that you may get. So higher the duration of untreated psychosis, more severe is your psychosis going to be. So all of this makes identifying stressors or triggers which can cause and cascade of mental health crisis in a person extremely important. And for that, we need to be able to reach out, we need to be able to interact, we need to be able to provide to the target population the services required in a way that they understand. So uh, again, kudos to the team at across Fortis, that we have bully to buddy programs running which help in prevention. We have peer social moderator programs running which help in spreading awareness of mental health. We have started to reach out to corporates at a very unique app level, and introducing and destigmatizing mental health is becoming a crucial factor. And of course, like I said at the start, thank you for adding IU to your life in the form of ADIU uh, at the state of art psychiatric care hospital that you started in Delhi, sir.
Thank you, Kedar. I think so. One important message that comes out from your is that use technology, leverage technology, because sometimes patients with mental health and the parents also, that stigma of going to a hospital and meeting the psychiatrist, that is one of the bars that prevent them from coming and consulting. So I think so use technology, because online consultants are there, so you can maintain your privacy. I think that's something that very important you highlighted. Thank you. Now moving to Jalandhar, Dr. Preeti, she's a physician with us at our new hospital in Jalandhar. So Dr. Preeti, asking you is that, what is your message? How do regular preventive health checks help control lifestyle diseases before complications arise?
Sir, good evening. Good evening, my fellow colleagues, my senior doctors, and so thank you for the question. And happy to be part of Fortis, sir. Yes, and so coming to the question, sir. First of all, these diseases, the unhealthy disease, these non-communicable diseases, they are actually mainly the result of unhealthy habits. The habits, the simple habits which we used to follow, our elders, our grandparents used to follow, like getting up early and then sleeping early, then taking food on time and taking regular exercises, do long walks, do gardening, and all those things. Sir, these under preventive health, it is recommended that at least once a year these preventive health checkups need to be done. And first of all, what happens here is mostly the patient get the test done and then they go to the doctor. But it is highly recommended that you first take a simple consultation and you discuss your family history, you discuss your lifestyle and the way you work, and then accordingly the tests are to be done. Many of the patients, younger patients especially, when we check their blood pressure in the OPD and it is raised, and they say, "Oh, ma'am, yes, few months back I got it checked, it was raised, but I did not have any problem." The people need to understand that in the early stages, these raised blood pressure or sometimes dyslipidemia or thyroid problems, they take it lightly. They feel that it is a part of their life, like they feel little fatigue, early morning fatigue, or they feel these checkups are done early. Blood pressure is checked like once a year, it is checked, and fasting blood sugar, postprandial blood sugar, which if it is raised, then further we investigate for diabetes. And the lipid profile is at least checked, because yes, we do take junk food. Our lifestyle is not that healthy. So accordingly, the earlier the tests are done and on the early stage, if the abnormalities are recognized, then alert. See, these things are going bad. They have started going bad. You have to change something. You need to do these changes in your life so that the things don't worsen. And even, sir, as sir has discussed, mental health is really a great issue. And what I feel is that your soul and your body is connected. So if you meditate daily, and you do deep breathing exercises, your body, there are more chances that the body will remain fine. So earlier checkups and obviously timely, this will really help, sir. And even obesity, sir, today's like sitting your, we can say that what profession you do. I ask the patients, aap kya kaam karte hain? So they say, yes, my job is like 9 to 6, I sit and I do job. So the back pains, the cervical here, the dorsum of the neck pains and the headaches, and obviously this eye dryness of eyes, and all these are very common, sir. And sir, I just want to give one example. A month and a half back, I got a patient in my OPD with the health package test, and he was 55 years old, sir. All tests were very, very, very good within reference range, and very few times we get to see such results that the patient is not on any medicines and all the investigations are fine. So I just asked him that, "What is your lifestyle?" Curiously, I asked. Sir, he said that I used to work 9 to 5 and busy home. But sir, after completing my job at 5 p.m., we had friends, 3, 4 friends, and there was a playground near our workstation only, and we used to play volleyball. Chahe, even for 15 minutes, ma'am, we used to play, or 20 minutes, used to play, never missed a day. And sir, I think that if we specify that I have to do exercise for 35 minutes or I have to do exercise for 45 minutes daily, maybe my work style is that I'm so that busy that maybe I'll not be able to follow. But at least a small thing, at least 15-20 minutes, they were playing those aggressively and aerobic exercises. So it has kept them physically healthy as well as mentally healthy. Very sound, very calm person. So like we are also very all our doctors who are sitting on the panel, and if a little bit time only we get for our own physical health. Not if not in the morning, after 5 p.m. go back at least 20 minutes. We do exercise. It will we sweat. Our hormones will will feel better, and I think mentally it will be healthy, sir. So that is the message for all our patients also, sir.
Okay, thank you, Preeti. And I come to Dr. Pankaj Puri again now. Is that what early symptoms related to digestion or liver health should never be ignored?
So first is two things are separate. One will talk of the liver and second will talk of the bowels, the gut. In the gut, many people come with acidity, dyspepsia. They'll pop in proton pump inhibitors, which is pantoprazole or it's rabiprazole, one of the drugs which decreases body acid. And that is all right, and a short trial is worthwhile. But you should not ignore it if you have few things which are red flag signs. Red flag signs will be if you're losing weight. If you're older, then you should be investigated earlier. If you pass black stools, if your hemoglobin is low and you have less blood in your body, then you should be investigated and you should undergo endoscopy and not just keep popping in pills for acidity. That's first. Second is people who come with constipation, as we discussed. If they are older, if they have blood in their stools, if they lose weight, they should be screened for colonic cancer. No bleeding per rectum should be attributed to piles without looking inside. Even if you have hemorrhoids, which are piles, you could be bleeding from a cancer which is 5 centimeters above. And there are many other causes of bleeding other than cancer. But the point is, bleeding should always be investigated. Constipation should not be ignored if you have weight loss, if you have blood in your stools, if you are older, and if you have pain. These are important issues where you should investigate. As regards the liver, the things to, if you have jaundice, if you have yellowness of eyes, it is obvious that you need to be investigated. But even simple things like fatty liver should not be ignored. Next, you should be screening for hepatitis B and C. See, because these go on to develop liver cirrhosis and even liver cancer. Who should be screened for hepatitis B and C? If you have a family history of hepatitis B and C, if somebody has in your family, if you have deranged liver function tests, if you have features of chronic liver disease on ultrasound, if you have had surgery or blood transfusions in the past, then you should be screened. So these are people who should be screened and not just say kuch nahi hota.
Thank you. Suhail, I'm coming to you now. Is that what common cancers in India are most preventable, and what are the simple steps that people can take? Because as we were speaking earlier, the cancer burden is increasing, 1.5 million new cases every year. So those who have got it have got it. But what is the message that we can look at for the preventable cancers?
So, sir, the buzzword in oncology is catching it early, and prevention is always better than cure. And therefore, the most common culprit in our part of the world, in our country, is tobacco in all its forms and manifestations, whether it is gutka or pan masala or a cigarette smoking or bidi or kheni. So any of these manifestations of tobacco are linked to oral cancer, and it's a highly preventable cancer. So in such situations, it will go a long way if we were to have a program where we can go for regular oral cavity examinations by our ENT expert or a dentist. People often underestimate the fact that even having a sharp tooth, which constantly irritates your oral mucosa and can lead to a non-healing ulcer, can also transform into a cancer in the long run. So if you have any of these abnormalities in your oral cavity, any oral ulcer that refuses to heal, any sharp tooth edge that keeps on impinging on that ulcer, resulting in its non-healing, please, you should go in for a regular dental checkup or an oral cavity examination. Second is cervical cancer. We already have a vaccine for prevention of cervical cancer, the human papilloma virus vaccine, the HPV vaccine, as I enumerated earlier. So from the ages of 9 to 14, all girls should be encouraged to undertake the HPV vaccination for cervical cancer and even afterwards. The third most common and preventable cancer is breast cancer, and it is the growing burden of breast cancer that we are seeing in our OPD every day. And now we are seeing younger patients as young as 25, 26 with advanced stages of breast cancer in our OPD, and they just neglect their lumps in the breast, thinking then that because mujhe pain nahi hai, so it cannot be cancer. In fact, pain is a very late manifestation of cancer. More often than not, a lump in the breast or anywhere else in the body, if it is painless, then you should arouse a suspicion for cancer. So breast cancer is easily preventable by doing annual mammography and a self-breast examination. Every month, a woman should do a self-breast examination at a specified time of their menstrual cycle. And once in a year, you should undergo a clinical breast examination by a trained expert, either a gynecologist or an oncologist. And finally, lung cancer. The burden of lung cancer is also increasing in India, and our very own Munna Bhai, Sanjay Dutt, is the poster boy of immunotherapy in our country. And many people come to us asking what is that treatment which has kept Sanjay Dutt healthy. So immunotherapy is the poster child of the 21st century new oncology drugs. But Sanjay Dutt himself has alluded in many of his interviews about his bad lifestyle and about the bad choices he made early on in life, because of which he had to suffer this particular problem. He was lucky to have found a hope in immunotherapy, which has kept him disease-free. So lung cancer is easily, again, preventable by doing a low-dose CT scan of the chest once every year. But this is not for everyone. This is for high-risk populations. That means people who are heavy smokers or who have a history of having smoked in the past for a substantial length of time, at least 15, 20 years of their lives. So these are the patients who should be taken up for screening. Now that sets the ball rolling for what Dr. Limai sir had said, and I was listening to him very intently, and he talked about running. So people ask me, in cities like Delhi where AQI is more than 400 and 500, it becomes extremely difficult for us to go for an outside run, you know. So I would take tips from sir. If the situation is conducive in Delhi, I would like to take that up as one of the habits, because I'm into high intensity interval training, and I like to skip rope, and I take pride in doing that every day and kind of enjoy it. So the mantra is, do an activity which you enjoy, which you can do consistently. And because it is the consistency which will bear the result. I cannot go for a 42-kilometer marathon run tomorrow with sir and then, you know, just do nothing for the rest of the month. So there has to be consistency in whatever you do. Make it a habit and make sure that you enjoy what you do. And that is what is going to be the buzzword for prevention in oncology, and for that matter, even other disciplines.
Thank you, Sohail. I think so. You hit the nail on the head. I think so. Pick them up early. And I think so. One of the things I would like to pass on, and the people who are hearing this, is that from the FICCI Health Services thing we have put up to the government, is that to make cancer a notifiable disease, make it a notifiable disease, then the pickups will also be picked up at an earlier stage. So the outcomes will be better. So I think so. I urge all those who are hearing this on this podcast, kindly put it up on a social media. Make cancer a notifiable disease. So I think so. From your association also, this is something that you all should be pushing. This is something will help immensely, because if you look at tuberculosis, because whether it's in the private sector, public sector, any tuberculosis case, it has to be reported, and there's the follow-up happens after that. The tracking happens. So for cancer, if this happens, you can pick up much earlier. You can pick up the incidence of where the disease burden is, and start looking at more preventive measures in that geography, for example. So I think this is something that I would like to urge all those who are on this podcast to sort of push this, make cancer a notifiable disease. Saurabh, coming to you now, is that which lifestyle factors are most underestimated when it comes to long-term neurological well-being?
So, starting from the lifestyle factors, I think one of the neglected factors is the sleep, sir. So, what I've realized is sleep is now picking up in a big way. Lack of good quality sleep, having sleep apnea, undiagnosed sleep apnea, causing mental fogginess, fatigue, hypertension, headaches. So, one is a good quality sleep, and recognizing whether one is having sleep apnea or no. That is one. Number two, I think, is a sedentary lifestyle, which is a silent killer. I This is one of the most important things. And other than preventive factors, what I've realized specifically for dementia and other aspects is the chronic stress and other aspects of depressive illness, and having recognizing dementia versus pseudo dementia. So if we are able to recognize these underestimated factors and able to rectify, treat them, so we can, I'm not saying we will cure, but we can identify, pick up the treatable aspects, and we can slow down or delay the progression of the disease.
Thank you. So a quick one, you mentioned something on the sleep pad. So what is the
So,
message you can give? Because a lot of time we keep hearing that reading and that sleeping early, going to bed early is a better way of having good sleep. Because if you recollect this, there's a talk about the NASA protocol of sleeping between 9:30 to 2, because that's the time when you have the deepest sleep. So your body rests the best, and your body means I'm talking about brain, body, everyone. So, is there any merit in that? So, is there any message that we should give to public that don't go to sleep late, sleep early, because the deepest part of the sleep is during this time?
so I think first thing is the quality of the sleep versus the duration of the sleep. I think sleep quality is what you are focusing on, which matters more than as compared to someone who says ki even if I sleep for 10 12 hours, I don't feel good, fresh, or I feel fatigue or heaviness even when I get up. So I think going to sleep by 10ish, 9, the protocol which you're talking is a good way of preventing secondary risk factors due to poor risk quality of sleep. And yes, because initially the non-REM, REM, and the cycle, so one has to have a good quality so that we are able to have a time bound active performance of the this thing. So I think this holds merit to some degree in my aspect as per the NASA protocols.
Thank you. Now, coming to Atul, how do routine heart screenings and lifestyle changes impact not just individuals but national productivity? Because as we are speaking about building up a vibrant Bharat, a Viksit Bharat, so I think so, because heart disease still is the largest burden. So if there's some inputs can be given from you, some take-home messages for the public.
No, I think that's a very, very important question, because if you look at it from a societal standpoint, if you have a young person such as the one that I just described, if he or she is the sole breadwinner for the family, and if he or she comes down with a disabling disease, whether it is cancer or whether it is a massive heart attack that leads him to have heart failure, or whether it is disabling psychiatry or liver disease, any of those diseases, and if he or she is the sole breadwinner, it has a huge impact on what his family will go through for the rest of their lives. So I think that prevention is the key aspect to try to tackle all of these issues that we have been talking about. And as I see it in my specific field, I think what I advise people is to pay attention to the big five. Those big five are diabetes. So make sure that you check your blood glucose, HbA1c periodically. Lipid profile, again, no, nobody knows whether they have high sugars or high lipids. The only way you find out is if you check for it. That's number two. The third thing is obviously tobacco and nicotine and smoking, which we discussed. That needs to stop. The fourth thing is lifestyle, which avoids having a sedentary lifestyle. So, some form of activity. I think somebody mentioned cycling, somebody said skipping rope, somebody prefers running. I think any sort of sport, any sort of thing that keeps you active, at least for 30 to 40 minutes a day, if we can incorporate that into our lives, that will go a long way towards improving our sedentary lifestyle and reducing obesity in general. And the fifth one is high blood pressure. And again, not everybody has occipital headaches or feels tired or has palpitations or breathlessness. Sometimes high blood pressure can just be a silent killer. And so it's very important to have your blood pressure checked. So I think those big five are the things that I primarily on when I wear the hat of a preventive cardiologist in seeing patients in the OPD and counseling them and their families to really have a health checkup and identify whether you have any of these five risk factors, pay attention to them, and make changes so that you're living a better and healthier lifestyle.
Thank you, Atul. Dr. Kedar, what early signs of stress or burnout should people act on before it impacts health and performance?
Right, sir. Early signs of stress, the most obvious one, like Dr. Saurabh was alluding to earlier, is sleep. Uh, I usually tell my patients and their family members that if the sleep is less than 4 hours, or if you don't wake up fresh for more than 2 weeks without any active reason for it, and your sleep is disturbed by multiple thoughts which are coming in, then you need to reach out and discuss. Preferably with a therapist, with a psychiatrist, if you know one, or even your close confidants. But sleep is one of the primary indicators which you will pick up very easily. The second one is concentration lapses, attention deficits, mistakes at workplace. Very often, while taking stress management seminars, what I invariably point out is that the first person to realize that there is something going on with you on a mental health crisis level will be your colleague. It is going to be your colleague, because that is the same place we are going to repeat the same things over and over again. So a discrepancy there is usually picked up earlier. So workplace mental health matters, and this is why if there are concentration difficulties, if there is mistakes being made at work, you should probably try and look at whether this is a mental health call. The routine red flags that are there, which are popular nowadays, but we have to understand self-harm, suicidal ideations, these occur at the fag end of the spectrum. What is likely to happen before is a decreased interest in daily activities, a decrease of your drive, not finding ice creams maybe as enterprising as you did earlier, or chocolates as interesting as you did earlier, not having interest in intimacy, lack of intimacy comes up. So decreased drives is again an pointer, and of course the routine ones, which are panic attacks, anxiety attacks, extreme phobia, irritability on minimum provocation, and intolerance to loud noises. These are some of the red flags and stress signs which we can actually end up picking up early for mental health interventions.
Thank you. Dr. Preeti, coming to the end of the session now, is that preventive screenings are most commonly missed but can be life changing?
So first of all, I want to say that women, they neglect their health more, right? And they need to be encouraged to come forward. And because if they feel body pains, chronic body pains, it is something wrong. There is something wrong. There needs to be corrected. So what I feel is that breast cancer, cervical cancer screenings, they are related to females. So they are more to be encouraged to get them regularly. And sir, other thing is, psychiatrist is here on panel. So what I feel is that mental health screening also needs to be done. You feel some problem at your workplace, you have a psychologist, or you have a psychiatrist there, or you have a friend here. So we have a psychologist here in the hospital, not psychiatrist. But when I feel, it's my personal example, when I feel some unrest at the workplace, I try to deal it with myself. But when I go to the psychologist, there's a different level of discussion and there's a different level of relief. So people, all of us, whoever is listening, it should not be taken as a taboo. Like meeting a psychologist or meeting a psychiatrist is not a taboo. You go early, have a friendly discussion with them, you will get relieved. 99% of times you will get relieved. And sir, I think this screening also needs to be done. And
Thank
sir,
you.
other thing is, people come for health checkups. Again, BP and cholesterol, when they are raised, they just ignore it. Okay, ma'am, it is due to my lifestyle. I will correct my lifestyle, but they don't correct their lifestyle most of the times. And after a year, 2 years, they get their tests done, and again, the things are further worsened. So, above all, sir, it's the mental health screening. I think that is the call.
Thank you. Now we come to the rapid fire round. So there's one question. Each of you all can just give in rotation. I'll leave it to you all. Is that one preventive habit every Indian should adopt today for a healthier, stronger nation? One preventive
Exercise.
habit every Indian should adopt for a healthier, stronger nation. This is the last round, rapid fire round. One by one, you all can just give your inputs, your take-home messages, please.
So I think I'll answer first. I'm very big on social connections. So my message is improve your social connections.
Sohel?
सर फिराक गोरखपुरी साहब ने एक शेर कहा है कि ये माना जिंदगी है 4 दिन की, बहुत होते हैं यारो 4 दिन भी. So mantra is, it's not just about adding years to life, it's about adding life to the years.
Wow. Thank you. Dr. Kedar?
Add Ayu, and most importantly, unmute yourself and reach out if you feel stressed, if you feel anxious, if you feel like you can't handle things. Reach out, talk to someone, unmute yourself, and add Ayu to life. Thank you.
Preeti?
सर खेल लो. सर जब हम बचपन पे खेलते थे, पढ़ाई करते थे, खेलते थे, और जब हम फिर पढ़ने लग जाते हैं, फिर हम खेलना छोड़ देते हैं. मुझे कभी
Saurabh?
So I think most of the things have been said, sir. So I think avoid sedentary lifestyle. Let it be khelo. Let it have social connections. Let it. So in whatever way you can avoid sedentary lifestyle, I think that is the mantra in whichever capacity, sir.
Pankaj, your parting shot.
Only two things keep you young. 2 F's: good friends and good fitness. So look at your diet, do exercise, and as we said, you often need, exercise. Your friends decide your fitness, but I have 2 groups of friends. One is good, healthy, nice, chubby, fat friends whom I spend a lot of time with, and the second is people who do a lot of fitness. Some of them are 40 years younger than me. So you have to have your friends, but you need your fitness as well.
Thank you. That's a defense officer speaking. And I'd like to just inform all the people who are watching this podcast. Fortis Healthcare is putting a lot of effort on seeing the preventive aspect. And on a panelist also, there are people who are actually walking the talk as far as fitness is concerned. Dr. Pankaj Puri, he did a 203 kilometers ride in the weekend. Dr. Atul Limai just finished the marathon last weekend. And all of them, they are very active in that. So the message is that we walk the talk. We want to sort of say that we want a healthy India. And the message is that, as rightly mentioned from everyone, more exercise, less this fatty food, less this junk food, get out and play, and adequate sleep. So I think so with that, I'd like to end the session. And first of all, I'd like to very humbly thank all the panelists for taking the time out from the busy schedule. I pulled them out from their clinical work. And so my humblest thank you to everyone. Namaskar from Fortis. Thank you.
Namaskar.
Thank you, sir. Thank you. Good night.
Thank you.